Hello, everyone. I am here to introduce to you Dr. Faris. I'm Dr. Shah of PlansConnect, and today for the mid-month meeting of the minds, I have the brilliant Dr. Basma Faris, who has many talents. She was first a dietitian in her career, and then she moved on to become an OBGYN physician like me. And I'm going to turn it over to her to let her tell you what's her passion and what she does.
Thank you. Thank you, friend. I'm so pleased to be here. I'm so pleased that we're now friends in real life, right? We were
Yes.
friends behind, friends on the screen for some time, and now that we've connected in real life, and hugged, I can really call you my friend, and so that's very special. So my passion, my professional passion, anyway, really is. My work that I do at the intersection of women's health and nutrition. It really allows me to use the full sort of breadth of my background, of my education, of my training, and I think fill a need that really is. There's a big need to fill in real evidence-based nutrition guidance for women across the lifespan. I have a real vested interest, a deep interest in polycystic ovarian syndrome because it's a condition where nutrition really can have an impact. But I really care about nutrition for women, really, not just in isolation in particular conditions, but really across the lifespan. And I sort of always have been. I started out. I got my undergraduate degree in nutrition from UC Berkeley, and then I moved back to the East Coast and got a master's degree and completed my dietetic internship. And I worked as a dietitian for nearly 10 years before completing medical school. And so about 5, 6 years before going to medical school, and I initially thought I would be an endocrinologist or a gastroenterologist, something I guess maybe a little bit more directly aligned with nutrition. But then I really just found that OBGYN was the space for me, was the specialty for me. And I've been trying to sort of merge the two ever since. And I've done so with varying degrees of success, but I tried to do it both in my clinical life and my teaching life and my life on social media, where I try to educate as well. So that's really where my professional passion lies.
I love it. Yes, the intersection of food and medicine. And, I so loved the College of Culinary Medicine's annual meeting that we just had in New Orleans. I loved how you ran it and what you did with it. It was phenomenal. Why don't you share a little bit about that meeting? What were some
Sure.
highlights for you?
So, one highlight was really having more OBGYNs there. This is something that I've been trying to do. I'm on the advisory board of the American College of Culinary Medicine, and this year I'm the chair of the advisory board. And really, one of my big goals was how do we bring more women's health practitioners to the meeting, to the college, to be interested in culinary medicine, where I really feel like there is a synergy. And so I was very pleased to see more of my OBGYN colleagues there, as well as midwives and nurse practitioners. And for us to be able to highlight women's health as one of the themes of the meeting. And so that was really great. We had an amazing second day of talks around women's health and nutrition and culinary medicine. And then I was able to teach some hands-on culinary portions specifically for pregnancy and PCOS. And I think that that is the first time that those hands-on sessions have been offered as part of the annual meeting. And that really went along with the theme of women's health. So I was really pleased the way that that shaped up, and that I was able to participate and teach those sessions. And so, for me, it really was a joy. I put a lot into it, but as always, I think got more out of it even than I put into it.
That is so wonderful to hear. Yes, for me, it felt like I felt connecting with you and that meeting reinvigorated my passion. Not that my passion had ever left, but I really believe in women's health. Women are the gatekeeper of the family. And not that women should be the cook or the chef, but often they're the ones in charge of the family. They're
Right.
the ones who get grandpa to the doctor, they get their neighbor to the doctor, they get their kids to school, they get their husband to work on time somehow. At least I know that's what my mother did. And so we really need
Yeah.
to embrace all that they do to make their lives easier and healthier. So food as medicine is key, and those classes were phenomenal. I loved the the pasta making class as well as the poaching and braising. And I really wanted to take all of them. So um
So you'll have to come back so you can take,
yes.
yeah, so you can take
Yes,
more of
yes.
them. But
I'm
you hit the nail on the head because really, you're right. Women are sort of the managers, the gatekeepers of the health of the family, and also when it comes to food. So these are two traditional roles that occur, and so right, traditionally, women tend to be the ones that are take on the responsibility of procuring food, preparing food, sort of arranging that as well as in addition to managing sort of the health of the family. So there really is that sort of overlap. And then also, so often in all the different roles that women play, sometimes neglect their own, right, their own health, and put others before them. And so making sure that, women, and finding solutions for women to be able to prioritize their health as well as the rest of the family is really important. That's one of the messages we heard, right, sort of throughout the meeting. And so I'm
absolutely.
glad you brought that up.
Yeah, it's so important. I mean, well, I also have a background in public health, so I always think about food for the masses, the environment, and your program covered all those topics. It was so amazing. So
Thank you.
tell me, what should we know for next year's College of Culinary Medicine meeting? It'll be the 12th year, right?
It will be the 12th year. It will be in New Orleans again. So loving that.
Yay.
The agenda, I think, is still being, fleshed out as we are a year away, but hopefully people will join us back there for next year's meeting because it will be different. Every year we sort of touch on different themes around sort of the fundamentals and food systems, and we make sure that all the different disciplines within culinary medicine are represented, right? Because it's not just
Yes.
for physicians. There is a track that's for food service professionals and also for all the different health professions. So a lot of dietitians, nurses, nurse practitioners, PAs, as well as physicians attend and participate because really to effectively put on or integrate culinary medicine into your clinical practice, really it takes all the professions. So it's very it's a multi or interdisciplinary field, and the conference represents that. So which is really nice because sometimes you go to some meetings and it's just all people in your lane, so to speak, and so it's nice to have those interdisciplinary experiences.
Completely agree. I would love to see some social workers attend your meeting as well. In my public health
Yeah,
work, I've worked with Healthy Start New Orleans, which was one of over 100 federally funded HRSA programs. And they worked with moms to help reduce fetal and infant mortality. So they worked on preconception care, prenatal care, and postpartum care. And one of the unique features they started here in New Orleans was having moms go to the market mamas match. And our farmers market here arranged also for matching contributions for those on SNAP, which is Supplemental Nutrition Assistance Program for women, infants, and children. And so if a woman was on this field trip with Healthy Start to the farmer's market, she could buy a bag of okra and she would get a second bag included for free.
nice.
And Now, I don't know if we gave them cooking classes, but those who purchased the produce, they certainly knew what to do with it. And I just love embracing all of this that you've got me reinvigorated for. So,
I'm so glad.
um, with that, what do you think we should tell everyone to do? Should they all attend your meeting? Should they follow the College of Culinary Medicine? Or wait, what about we didn't even talk about your new venture, Dr.
Yes.
Fritz. We need to talk about that.
So yeah, so please follow the American College of Culinary Medicine on Instagram. Their Health Meets Food, also on LinkedIn, and so you can be updated about next year's meeting. And I hope you can attend either in person or even virtually. But thank you. Yes, so I just sort of, I've had this practice. I just sort of relaunched my telemed practice. I have a telehealth practice that is solely focused on polycystic ovarian syndrome. And I just reintroduced a membership model because what I really find is that when people want to make change, it doesn't happen overnight. It takes time and you need the support. And so rolling out this membership model really represents my commitment to my patients so that they know that I am there for them, and that I'm going to really be on this journey with them. And so when people choose to enter the practice for that first year, they're going to really have this intensive experience with me. That's going to last the whole year. So it's 6 visits, including a lengthy first visit, which is 60+ minutes, because I often just sort of go over where we really go through A to Z, everything that relates to somebody's PCOS, their history, their diagnosis experience, a nutrition assessment, and really to fine tune sort of what are the things that really are impacting them and what are the behaviors that we think are going to make the most impact, and to meet people's goals, because everybody has a different goal when it comes to their health and wherever they are in their life stage. And so no one person's sort of care plan is going to be the same. I also have this very extensive library of videos that I've made that really just covers PCOS A to Z. And so then my patients have access to all of those videos as well as workshops, and they can really contact me whenever via secure messaging. And so that way, like I said, I'm committed to them, they're committed to the process, and I'm really excited about that. So that really just kicked off in the last week or so. So yeah, so thank you for letting me share about that.
Well, I think it's wonderful speaking as your friend and talking about my personal health issues with you in the past year. I noticed that, excuse me for coughing. I noticed how kind and thoughtful you were, and I know your patients must already love you, and your new ones will too. And if I'm
Thank you.
correct, your website is www.drbasmafaris.com, right?
Correct. Yes, easy to find me. And that is, that's my name. That's who you're gonna get. You're gonna get just me. And that just also aligns and matches with my social media platform. So on Instagram, I'm Dr. Basma Faris, and you can find me there as well. So everything is sort of aligned and makes me easy to find.
I love it.
Thank you.
And with that, I think we'll end our podcast and hope our listeners will follow you. And those who need help with PCOS, let's hope they connect with you if they can, connect with you for their services. And for those who want to know more, keep listening to Plans Connect. We've got more podcasts about more amazing people in the world of science and women's health and public health. And there's no telling who I'll be connecting with you with because I have a lot of amazing people to introduce the world to. So,
She knows everybody.
so thank you so much. And
Thank you so much.
I'm so happy we could do this, Basma. I
Me
really
too.
loved it. Thank you.
Thank
And
you,
I know
Swati.
you're going to keep doing great things for your patients. I just know it.
Thank you.